Good day everyone. So my name is Van Jason Ardaza and today we will be talking about leprosy. So leprosy is also known as Hansen's disease, is a chronic infectious disease caused by the bacterium Mycobacterium leprae. So it is mainly a granulomatous disease affecting peripheral nerves and mucosa of the upper respiratory tract. Granulomatous is basically referring to granulomas, which are lesions of epithelioid macrophages. So, before we go and dive into the topic, let's have a little background check or a little history check. So, Gerhard Henrik Armander Hansen was a physician which first identified Mycobacterium leprae as the cause of leprosy in 1873. So basically, siya ang physician nga ang sakit, the leprosy, which also known as Hansen's disease, gikan sa niya ang name sa disease, which is Hansen's disease. Kasi siya man ang naka-discover sa disease process. So, a little taxonomy check also. So, Mycobacterium leprae, yung kingdom is under siya sa bacteria nga kingdom. The phylum is Actinobacteria, order is Actinomycetales, and suborder is Corynebacterianae, and the family it belongs to the family of Mycobacteriaceae. And the genus is it falls sa atong Mycobacterium nga genus. And of course, atong species is ang atong naibawan nga Mycobacterium leprae. So the pathology is that kani si M. leprae is a gram-positive bacteria. It is aerobic and rod-shaped nga bacillus with a waxy nga coating. So M. leprae is unable to grow sa in vitro. So this is thought to be due to the fact that it no longer has the genes needed for independent growth. So basically, it needs a host, particularly most common makita nato sa mga mice and sa armadillos. So mo ni sila ang mga host nga makita nato si M. leprae, since dili man siya maka-independently grow by its own kay wala siya DNA to do so. So, for the clinical features, makita nato usually ani nga sakit is skin lesions, typically anesthetic at the tuberculoid end of the spectrum. Thickened peripheral nerves, acid-fast bacilli on skin smears or biopsy. Acid-fast is a property of mycobacteria in which resistant sila sa decolorization by acid during gram staining. So, katong ilang inability nga ma-stain during gram staining, this is a helpful diagnostic tool for M. tuberculosis and M. leprae, since usually the bacteria dili man na ma-stain man na siya, but because of its ability to resist the decolorization, it serves as a diagnostic tool para ma-identify ni siya nga bacteria. Okay? So for the symptoms, ato siya is differentiate. So ato na siya So ang tuberculoid, ang iyang mga infiltrated lesions is defined plaques, irregular ang iyang shapes, and ang iyang healing centers. So sa macular lesions, this is usually single and small. And for the peripheral nerve lesions, makita natin diri nga solitary and enlarged ang mga nerves. So sa borderline tuberculoid, ang iyang infiltrated lesions kay under sa skin is polymorphic, partially raised edges, and more siya satellite shapes. And for the macular lesions, natay mga several and any sizes. So in comparison to the tuberculoid nga single ra and small, kani siya is it occurs in different sizes, and multiple siya instead of single. For the peripheral nerve lesions, irregular enlargement of several large nerves, and ang iyang pattern is asymmetric. So for the borderline lepromatous, so na siya mga papules, nodules, punched out centers sa mo na siyang characteristics sa iyang infiltrated lesions. For the macular lesions, it occurs in multiple and all sizes and even bizarre sizes. So basically, it occurs nga na mga dagko kay nga lesions, macular lesions nga ma-identify, makita nato sa borderline nga lepromatous. So for the peripheral nerve lesions, natin mga many nerves involved, symmetrical ang pattern niya. So we can easily differentiate borderline tuberculoid with borderline lepromatous because of the lesions, the pattern of the peripheral nerve lesions. So borderline naman, we have here infiltrated lesions niya is diffused and thickening. So baga siya and diffused and more siya scattered, not dili siya kanang naka-localize ang yang area nga gi-attack or makita nato ang lesions. For the macular lesions, innumerable. So basically, di na to maihap and it occurs in small sizes. So unlike tuberculoid, small sad siya. However, there is only a single lesion. Unlike sa borderline nga damo kay siya and diffused siya, so di na to maihap technically ang iyahang lesions. For the peripheral nerve lesions under the borderline, late neural thickening is asymmetrical siya and anesthesia and paresis. So for the lepromatous naman, we have diffused gapon thickening, the same that of the borderline, and however sa macular lesions is innumerable gapon siya and confluent. So makita nato diri no nga confluent sad siya. Compare nato sa what you call this, sa borderline is unlike small siya, so confluent siya sa lepromatous. So next is nga sa peripheral nerves lesions, natin gitawag nga slow symmetrical glove and stalking anesthesia. So ato nato siya i-take note nga contrary sa atong popular belief nga leprosy does not cause body parts to simply fall off. So mo undergo siya process before siya happen kanang mga body parts nga madaot and eventually mga will end up to amputation. So it does not occur like diha dayon, and again it undergoes a process and kanang growth sa bacteria nga naga-infect. Okay, for the immunology, so tuberculoid leprosy, under patients' lymphocytes respond to M. leprae in vitro. So skin tests with lepromin elicit a strong positive response. So they also have a Th1 type response, producer interleukin-2 and intergerons Y. So these strong cell-mediated response clear antigens but cause local tissue destruction. So that's for the tuberculoid leprosy. So for the lepromatous leprosy, so patients in a case do not mount a normal cell-mediated response to M. leprae. And in fact, ang ilang mga lymphocytes kay dili siya mo respond sa M. leprae in vitro. So they are also unresponsive to lepromin as kanang opposite siya sa atong tuberculoid leprosy. And here they have a specific T cell failure and macrophages dysfunction and problems producing interleukin-2 and intergerons Y. But they do produce Th2 type of cytokines. So ato balik so tuberculoid is so di siya mo respond sa kanang lepromin, mo respond sa tuberculoid ni lepromin but sa lepromatous sa dili. So nga resad sa when talking about the ang Th1 type makita nato sa tuberculoid. So Th2 type nga cytokine makita nato sa lepromatous leprosy. So how is leprosy transmitted, man, we may ask. So the transmission of leprosy is thought to occur through the respiratory tract. Infected individuals discharge through their nose and a healthy individual breathes them in. So, but it is important to note that the extract mechanism is not known sa ani nga kuan ng exact nga mechanism of transmission. But the main reservoir is humans, as again, ako gingon ganina nga M. leprae, it needs a host para mabuhi siya. So, ang risk group ani niya is children of young age, people living in endemic areas, especially katong na mga hugaw squatter areas and katong mga third world countries. So, in poor condition, insufficient on diet, and or have a disease that compromises their immunity. Example of that is HIV, which there will be defects sa atong immune system. So, in the 19th century daw, leprosy was believed to be a hereditary ailment. So, later studies suggest that it is not, but it's merely an infectious process in which makuha nato sa mga katong mga ako gi-mention nga etiology. So, how is leprosy diagnosed? So, it is diagnosed, it is clinical by finding signs of leprosy, and mag-support siya with the use of acid-fast bacilli smear or skin biopsy. So, kani si smear, it will basically undergo a laboratory test nga makita nato kung what type of bacteria ang present ana nga sample. So, how in sa skin biopsy, it needs a part of the skin nga infected kung mag-identify sad nato kung sino ang mga ang bacteria nga responsible ana nga changes sa skin. So, but this is contingent or experienced histopathologist. So, usually what doctors typically look for include anesthesia for skin lesions and peripheral nerve thickening and tenderness. Ako siya na-mention ganina sa mga symptoms nga there is peripheral nerve thickening. So, also there is no serological test as of this date para to diagnose leprosy. So the treatment and management, usually treatment for leprosy is chemotherapy. First line drugs are rifampicin, dapsone, and clofazimine. So the World Health Organization recommends that if a patient tests positive in an acid-fast, they should be treated for multibacillary disease. So the patient's bacterial load decides length of treatment is around 6 to 24 months or 6 to 2 years. So patients tend to improve quickly with minimal side effects. Second line of drugs are afloxacin and minocycline. So triple drug combination have been used in cases where a patient has only a single lesion. So leprosy is combated with multi-drug therapy to reduce the chance of developing resistance. So since 1960, na siya resistance nga na-develop, which is resistance to dapsone nga medication. So that's why it is advised that we should follow our doctor's order regarding the duration of taking of antibiotics para to prevent such unwanted nga complications such as kaning resistance. Okay, so another treatment and management. So new nerve damage. So patients with motor or sensory loss of 6 months or less should receive a 6 months treatment of corticosteroid. So mo siya ang treatment for type 1 nga reaction. And of course, as a nurse, we should educate our patient. It is very important since within a few days of starting chemotherapy, since patients will no longer be infectious and can live a normal life. So currently, there are fewer leper colonies left. So karon, since there are medications that are specific for the treatment of leprosy, there are only few colonies left na lang. Thus, ang iyang effect is lesser na siyang occurrence nato in this time. Also, care of limbs is very important. So, ato gid kanang ilimbyuhan kanunay ato instruct to patient nga ilimpyuhan kanunay ang ilang limbs para to promote um, para dili na magka-promote og bacterial growth. So in order to prevent disabilities, so nerve damage produces anesthesia, dryness, and muscle weakness, in which it can cause misuse of affected limbs, causing ulceration and infection, so leading to deformity. So dryness can lead to skin cracking and ultimately infection. So treatment involves soaking and applying oil-based cream to affected areas. Also, physiotherapy can help prevent contractures, muscle atrophy, and overstretching of muscles. So in cases good na dere, we should always moisturize our skin enough nga dili siya mag-dry nga maka-lead sa skin crack, but not too moist nga maka promote o bacterial growth. So we should have that balance between the two. So another treatment and management. So immune-mediated reactions. For type 1 reactions, it occurs in borderline leprosy. So type 1 reactions, ang iya ko is delayed hypersensitivity occurring at the site of localized M. leprae antigens. Skin lesions appear and are erythematous, and peripheral nerves become tender and painful. So loss of nerve function can be sudden. Example, foot drop. Type 2 reactions occur in borderline lepromatous and lepromatous cases. So type 2 reactions are erythema nodosum leprosum or ENL. It results from immune complex deposition. So the main symptoms are malaise, body malaise, fever, and crops of small pink nodules on face and limbs. And ENL may continue for years. That's why atong gimension nga duration of treatment ganina depends. It goes for around as minimum 6 months and to a maximum of 2 years. Management procedures include controlled inflammation, pain, and treat neuritis and halt eye damage. And for the vaccines, currently there is no existing vaccines against leprosy, but there are trials investigating the effectiveness of the BCG vaccine, the ones that we Filipinos have sa atong pagkabata. So for the pathophysiology of leprosy, ato lang ni siya giulhino kay it needs a kanang conjugate siya kanang time to discuss this. Okay? So leprosy, ato na ni siya for the pathophysiology natay M. leprae. So M. leprae nga bacteria, it enters through the respiratory tract. Though C1 cells in cooler places, cutaneous nerves and peripheral nerve trunks of limbs and faces. So bacilli multiply in the Schwann cells. So kani siya after ani na siya duha ka kuan. So if good ang CMI response, there will be no skin or nerve lesions that will appear. And if weak sad ang response sa atong CMI, there will be a multi-bacillary leprosy. And in addition to skin and nerves, eyes, testes, kidney, reticuloendothelial systems get involved. So there will be more systems nga ma-affected if weak ang atong CMI response. So these two, although there is a good response, CMI response, so it will still lead to disabilities and deformities together with that weak CMI response. However, in good CMI response, the disabilities and deformities is minimal or less compared that of the weak CMI response. So the again, ako i-repeat. So for the complications ani niya is blindness or glaucoma, since it affects it may the infection may go to the eyes. So hair loss and infertility. So for the treatment, moto katong 2 antibiotics, dapsone and rifampicin. So and also as well as clofazimine. So why 2 antibiotics? Ako i-review. So dapsone, as ako gi-mention ganina, is nakakuha na siya og resistance sa aning ang M. leprae naka-develop ng resistance against this antibiotic. That's why it is paired with another antibiotic, which is rifampicin. So, ang diagnosis, again, is skin or nerve biopsy, paucibacillary leprosy, nasal smears. And for the clinical manifestations, natay discolored patches of skin, growths, nodules on the skin, thick, stiff or dry skin, painless ulcers on the soles of feet. So, an nursing diagnosis anemia is disturbed body image related to obvious rash, patches, and nodules on the skin. And for the nursing interventions, we have to exhibit positive caring in routine activities, provide hope within parameters of individual situations. So, kung ato gid tagaan og if we are going to give hope, we should stick to the facts o kung unsa gyud ang current condition sa patient, and instead of giving a false nga reassurance. And lastly, we have to encourage family interaction with each other and with rehabilitation team. So the prognosis is without treatment, leprosy can lead to permanent muscle weakness, nerve damage, and disfiguration. So even with treatment, recovery from neurologic impairment is limited, but skin lesions generally clear within the first year of therapy. Discoloration and skin damage typically persists. So that's it again for leprosy, and I hope you have learned something with this discussion. So thank you so much for listening, and God bless.